Hey everybody, I'm Dr. Dave Lenihan. I am the CEO of Tiber Health Corporation, which is the parent of Ponce Health Sciences University. And I'm here with Dr. Poudel, and she is an assistant professor here at the university and does some research in CBD, correct?
Yep.
And what do you teach? What do you do here at the university?
I teach physiology to mostly the MSMS program and some of the courses in the MD as well.
Okay.
Yeah.
And so what's your research in?
My research was mostly focused on the neuroprotective effects of the cannabinoids against chemotherapy-induced cognitive impairment.
What's that mean?
It means like a lot of times, people with chemotherapy, they experience different side effects related to cognitive difficulties.
Right.
And even though like they are getting treatments, the survival rate is getting high. People are not fully cured, not in terms only about the chemotherapy, but also in terms of the mental health.
How does CBD help with the mental health?
So CBD, in my research, I use 99% pure extract of that CBD, which is extracted from the plant Cannabis Sativa, which has proven to be neuroprotective against various forms of the neurological disorders like schizophrenia, Parkinson's, and they have the very antioxidative and the anti-inflammatory properties.
So it works not only for chemotherapy, but for Parkinson's disease?
Yeah, it has proven to be effective against them.
And it helps with the emotional side of the depression, or does it help with physiology of the thalamus, or what's it do?
So there are lots of mechanisms behind it.
I feel like you're doing your thesis, aren't you? Like your oral presentation, your thesis. You're asking a question. I don't mean it like that, but I'm curious about this. So
yeah, it's like they have a lot of mechanisms. Like it's not only one mechanisms, and we really don't know what is the exact mechanism, but people have done research on neuroinflammation, neurogenesis. There might be only the anxiety and depression like behaviors. Particularly me, I try to look into how CBD can help mitigate the side effects caused by chemotherapy called doxorubicin, and especially in the anxiety and depression like behaviors. And I try to look at the one of the mechanisms called the neuroinflammation.
I mean, a lot of the legal aspects of CBD came because of chemotherapy and cancer, because it helped with the depression and dietary stuff. Are you looking at those things, and like how are you sampling your research to test that? And also importantly, how are you teaching the students about this?
Basically, I did more of the behavioral side. So where I worked in my lab setting, we worked with the long episode rats, where we inject our doxorubicin chemotherapy to our rats for a month, every week at a dose of 4 mg per kg. And then we also give the oral treatment of the CBD so that we can look back and forth.
All right. And what did you see?
So we found out that in our rats, the doxorubicin treated rats had more anxiety and depression like behaviors when we observed them with the various behavioral tests that we normally use in a neuroscience lab. And CBD helps to mitigate those anxiety and depression like behaviors. And apart from that, we also isolate the brain samples and try to look into the expressions of the various neuroinflammatory genes, whether the expressions are being regulated or not.
So why are you interested in this type of research? And you can't say that's what I wanted to do in undergrad. So what made you interested in this, and why is it exciting for you?
And cancer is a very hot topic.
Yeah.
Everybody knows that. And one of the things that excites me more is even though they are having a good treatment, they are having side effects. Is the drug not working well, or why are they having side effects? So how can we mitigate the side effects of certain drugs so that we can go towards the treatment side in a better way? So that was something that made me very curious to know about the neurological side effect first, and then go and search about how we can mitigate that neurological side effects.
And there's another thing too, that if the patient is more adaptable to taking the drug, like they can tolerate it, they're more likely to continue taking it. And so that makes their life better too. I'm sure students have to be interested in this. This is a big topic in the world today, legalization of this stuff. So what are you telling students when they ask about this stuff?
So normally I have seen a lot of students getting very interested in this kind of research, because this is something that can be related by many people.
Right.
And it is very interesting to know, cancer treatment, it has a lot of side effects, and people especially kids. They are interested to know the mental health disorders, and then it's very interesting to figure out like whether we can alleviate the effects,
Right.
so that we can find out the good treatment for cancer.
I know mental health is becoming a big topic. It's last 10 years has become a big topic, especially for medical students and general population. And so it's good to see that we are researchers at the cutting edge of that here at the school. So you went down to the PRI conference. The PRI is the Ponce Research Institute, which is the research arm of PHSU. What was it like going down there? Now, I've been going to this conference for 12 years now.
Wow.
And I know Dr. Thompson Canera has done a great job with it. And it's grown so much. It's such a large event now.
Mm-hmm.
So what was it like going down there? Was this your first time going to it?
Yeah, it was my first time, and I really had a very good experience because technically this is also my first job as an assistant professor, so
okay.
that I could learn so much of things from the senior professors. And I really like we have a lot of opportunities in research. I got to learn about like grant writing, how do I connect with people, and also a lot of professors in there and whoever presented, they have done an incredible job in research, and it really helped me connect to the people from where I can still grow.
I think one of the great things that Dr. Thompson's done with PRI is our grant writing resources. And I don't know if you noticed, but we have like 4 to 6 R01 researchers now in Ponce, which is, for the size school we are, there's massive amount. But I think that really started 8-10 years ago when she started developing all the IRB protocols, the ability to create grant writing. And so new assistant professors like you get to utilize all those services.
Yeah, it's kind of a little bit, it's kind of pressure as well.
Is it?
Yeah.
Okay. I don't know if that's bad. That's good, right? A little pressure.
That's a good thing.
Right?
If you have a pressure, you're going to work more, and
Yeah.
then you're going to progress.
And you're going to produce out more research so people can take advantage of this.
Yep.
and get better. I'm glad you had a good time at the PRI because I think it's the best one on island and could be the best one in the southern part of the United States. So it's a top notch.
It was a fantastic conference.
Well done. It's very exciting.